Okay, welcome back, folks. We are picking back up on 766, drafting request 766. We are on page 8, section 202. Now we're getting to the beginning meat of the bill. So take it away, Katie.
Okay, so this section 2202 establishes a program. The Vermont Homelessness Response Continuum is established to create an array of services that prevent and address homelessness in Vermont. The program shall be administered by the Department's Office of Economic Opportunity. The department shall maintain a continuum of care that is flexible, housing focused, and designed to prevent homelessness whenever possible. The continuum shall prioritize early intervention, rapid resolution of housing crises, and equitable access to emergency and permanent housing. And then 2203 is the continuum of care components. This is where we have our list of what is in the continuum. It shall consist of the following services: prevention and diversion services, emergency housing services, shelter services, specialized shelter services, permanent supportive housing services, and other services as necessary. So the format of the bill for the next few sections tracks each of those lines. You'll see we kind of, there's a place where we kind of aren't following it as closely, but at least for the first four, we're following along.
And I'm just wondering, since we say the continuum care shall consist of the following services, we don't need services in each one of those things,
Sure.
right? Or we just say of the following and we leave services either way.
Do you have a preference?
Uh,
My preference is to just end it at following.
okay,
Okay. Then in B, the Office of Economic Opportunity shall address each of the services in subsection A of this section by separate line items in its budget. The department shall be responsible for any transfers to other Agency of Human Services departments necessary to implement the services listed in subsection A of this section. The department and other departments within the Agency of Human Services shall maximize federal receipts as applicable for services listed in subsection A of this section. So I just want to flag that in the first sentence, you have OEO,
yeah,
and then you switch to the department. So maybe it's just worth flagging for now.
well, in B, that really is accurate.
Okay.
But I put under B.
Yep.
Up above. In 2202, I'd change that to office.
Okay.
Right. But it is the department who initiates interdepartmental transfers.
Okay. And maximizing federal receipts, the third sentence is also
Yes.
department.
Yes.
Okay, so now we come to 2204, which is the first item in that list that we just went over in the continuum.
Just before we move there, I just want to make sure that we had some brief discussion about it, but I'm on the top of page 9 where we're talking about maximizing federal receipts. So in some of these cases, so I do believe in some of the substance use and potentially some of the Dale services that are envisioned here, that we should be able to utilize global commitment in some fashion for at least part of it. So that will take, some work, but so I just wanted to call people's attention to that. That's all. And we've been joined by our friend from Appropriations. Hello, Representative Lilly.
Hello, friends. Hi, good to see you come in.
Okay, now I'll move to prevention and diversion. Prevention and diversion services shall function as the primary entry point to the Vermont homelessness response continuum for all households. The department shall ensure that prevention and diversion services are provided through an agreement with one or more community partners throughout the state. The households, upon request for assistance, shall receive a standardized prevention and diversion assessment to identify safe alternatives to homelessness and resolve immediate housing barriers. Prevention includes activities to avert entry into homelessness, including financial assistance, landlord mediation, and legal assistance. Diversion includes problem-solving interventions and supports that safely resolve a housing crisis without the use of shelter or hotel placements. Funds administered for prevention and diversion services shall have maximum flexibility.
I just wanted to flag the safely resolves a housing crisis without the use of a shelter or hotel placement. And just want to make sure that these flexible funds would be available to someone if all the other options were all the shelters were full, all the other things, there weren't other resources, so they were housed in a hotel, but maybe after 8 days they find another solution that maybe they need some financial resources, that this language wouldn't prevent them from being able to use those flexible funds.
So I have a question about that. I mean, the federal definition specifically says without the use of shelter services. Yeah, go ahead, Lily.
Thanks, Brett McGill, this is Lily. I think that, and this kind of follows up on the conversation we started to have earlier. I wonder if it's prevention, diversion, and then exit, like support to help people exit homelessness. I think that's what seems to me to be missing is, for instance, I think about half of our current health financial assistance goes to people who are experiencing homelessness, using the money to exit homelessness and get into housing. A small subset of that could be considered diversion, but the funding, for instance, that we currently give shelters for this, we call it diversion and rapid exit funds. I think again, our financial assistance as a whole, we would really consider it as
I don't think
exit, and you can use. I share some of the same concerns. I think with Brett McGill that this is potentially inadvertently missing
so. What I just did,
the intention.
yeah, what I just did, because I think we risk if we say what they are. This is more about, we've already defined them. So I'm thinking that this is like more about how they're accessed in the system and about, being flexible and all that. So I honestly, I think about this from the state trying to implement something and say, oh, well, we didn't say exactly what we said in the definition here. So I'm just wondering if this is a question, Katie, since we've defined them already, do we actually even need what's on lines 13 through 16?
Right.
The rest of it says that this is where we would expect people to enter the continuum because we want to see if we can prevent your homelessness or divert you from being homeless. And that they have to receive a standardized assessment in this process, blah, 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 blah. And that the funds administered shall have maximum flexibility. And I wrote something about being available in all regions of the state. I added that. So I'm just wondering I'm not sure we need to actually add definition here because we already say what it is.
Prevention and diversion both
Are defined.
If they're slightly different, that just introduces confusion.
That's my point.
I guess what I was saying is I don't see, for instance, financial assistance anywhere else in the bill, and I may be missing it. The way I interpret this right now is that if you have been in a shelter for 9 months, you're experiencing homelessness, you have the opportunity to, move in with your mom or get into housing, you might not be eligible because that situation is not prevention or diversion situation. So I think I agree with what you're saying, is I'm not sure the right place of where to address that. And maybe again, it's like diversion or exit in the definition, or
Well, maybe when we get to
Yeah.
shelter services, like that particular instance, we could include short-term financial. Although.
Yeah, I thought that was part of the services that we just listed out I thought that's part of the shelter service.
Financial assistance isn't necessarily part of the shelter services.
right, in that example, it was, but right, if you were someone unsheltered in your car for 9 months, you have the ability to get into housing. Are you?
really being diverted? Are you being diverted?
Right,
It's,
and I would say, I don't know.
I think you're being diverted. I mean, the definition, let me just pull it up so
You're
I
not being
can,
diverted from homelessness. You've been homeless for a while.
yeah, I know, yeah. I'm just gonna. Come on, sent items. I'm gonna just read it again, come on. Strategy aimed at preventing homelessness, immediate alternative rather than entering emergency shelters. Focuses on providing support and ensure homelessness is rare, brief, and non-recurring. It, and it says recently lost their housing.
Is
So
that the
I,
HUD where?
this is the HUD definition,
Okay,
yeah. So, so it's maybe a different thing. I mean, it doesn't seem to really fit the diversion definition of HUD.
I agree.
It,
And
it's,
it
it
doesn't-
else you need flexible money for, but it's not.
Yeah. All right, so let's just like put that on the, yeah, I was trying to think of that term, parking lot.
Okay.
Could I move on to emergency housing
Yeah.
services? Okay.
But I have deleted the definition where it says includes in my version,
In 2204,
yes.
okay,
And I think that we need to say that department shall ensure that prevention and diversion services with one or more community partners. It is saying throughout the state. I just want to make sure that are available in all regions of the state instead of just saying throughout the state.
Right, throughout the state is different than
All regions of the state.
Yeah.
what line are you on? I'm sorry.
Are provided through an agreement with one or more community. It's on the 9 and 10.
To ensure availability throughout the state.
Yeah. In each region of the state. I want to be specific to region. I could say. Yeah, I don't think we want to say specific as county because Franklin and Grand Isle might be combined. So,
Okay.
okay,
2205, emergency housing services shall consist of, we have a list of 3. Financial aid to municipalities throughout the state to ensure equitable access to shelter without regard for eligibility when the National Weather Service declares a cold weather advisory. Services provided pursuant to the subdivision shall be time limited, shall not require coordinated entry, assessment, or case management, and shall have minimal data reporting requirements.
yeah, go ahead.
Is the intention that the only recipient of these funds are municipalities?
In this one, yes. Municipalities need to see themselves in the bill.
But number 2 is,
Number
All the
2
others.
is the other ones, yeah. Do you have, can you be more specific in your question if you have something else? What are you envisioning?
I'm just trying to.
We currently have municipalities acting in that role as the
Yes,
lead.
Yes, we do.
In one, and then in 2, they're playing a supportive role and or providing space.
And where the space.
Yeah, town of Middlebury, for instance, stood up shelter. And right now, it's kind of hit or miss about whether or not they receive any state funding. I mean, if it's being done through what Interfaith Action has, they might be able to get some support, but do you fund any municipalities directly?
This year, the state of Vermont is not funding any of the shelter projects directly. We funded Vermont Interfaith Action and then they fund the projects directly, so they are funding the city of Rutland, I believe, directly, and then in Burlington and Montpelier, some city resources are being leveraged.
So it's to provide some assistance, and it's not gonna mean every municipality gets money. I just want to be clear about that.
It's just a type.
Yeah,
Yeah.
And you're envisioning this, if, for the sake of argument, Interfaith Action takes on a similar role in the next few years. This is outside of that,
that's number 2.
right? Interfaith is number 2.
So,
So do we feel that having them funnel their work through Interfaith is too burdensome or is limiting on a community's acting on an intention? I guess I'm just trying to, seems like we're setting up parallel systems, and I'm just trying to understand the intention.
The intention was to reflect what's currently happening. I didn't have any other intent other than that. I see the point that it's, could be parallel, but I also see that it's, yeah. I don't necessarily have a preference one way or the other than municipalities very clearly need to see themselves represented in this bill.
And
And
Vermont
the feedback that I'm getting,
Interfaith Action, are they statewide? Like, go,
I think that they
they're
are,
statewide now with the grant funding that they've been receiving?
So,
Well, they're the administrator. I mean, you could have a notice of funding for an administrator and they were the successful bidder and they are the operator for the whole.
For
statewide
the whole statewide program.
so is it an intentional difference or do we need to work on the number 2 are emergency cold weather shelters, which are defined, and that's the 10-degree definition under the National Weather Service forecast. But number 1 is for equitable access to shelter when the National Weather Service declares a cold weather advisory. I don't know what their cold weather advisory limit is, but
it's colder than 10.
it's colder than 10.
Yes. It's what we've been experiencing the last 3 weeks. And when you get the little notice on your phone that says we're declaring a weather advisory for your area.
so that's a technical term, a cold weather.
Yes, it's a technical term.
Okay.
It means,
That's what I mean.
and you don't see a temperature there because
It depends on
It depends
where you are,
on
right?
where you are,
If you're
yeah.
way down in the south, it comes on when it's 30 degrees. It does actually. I mean, it
Oh,
actually does.
you mean southern United States.
Southern United States.
Oh, no.
Not applicable.
People say cold advisory, cold
I know.
weather warning, you know.
Brazil, right?
I know. It's summer in Brazil.
With respect to municipalities seeing themselves, and I like that concept. I'm still a little uncertain about the concern I have about parallel tracks here for these shelters. But I guess I thought the municipalities seeing themselves was more in the use of services that's called upon by, we had the mayor of Rutland in my community, and others. It's the draw on EMS, fire, and police. It's often been what's,
Yeah, we are probably not going to do that in this bill.
Not gonna do,
Not the intent. Aiden,
so,
sorry. Yeah.
Aiden Carpenter, Zatz and Renfrew Consulting. Would you be willing to clarify that statement about not doing that in this bill?
Sure. We are not going to, and I mean, this bill is intended to provide shelter and emergency housing, not to pay for police, fire, rescue.
so,
Is that clear?
yes,
Okay.
although could you describe a situation in which how it would activate? How would a municipality actually receive money?
So, no, I can't describe exactly how it
Oh,
works.
no,
because
just
it's
your
new.
vision. Yeah.
But there would be each one of these buckets okay, that are outlined here in the continuum of care.
Yeah.
And we have in the parking lot, the flexible funding area, okay? Would have a funding bucket assigned to it, so it'd have funding assigned to that area. Okay? And I thought I actually had that, an amount appropriated. Did you take that out, Katie?
There were no amounts that.
I think that it's later.
Oh, I have it all in one section.
Oh, okay,
One appropriation section.
okay. When I was drafting, no.
Section that said. That's under shelter. To the
Yes.
extent funds are appropriated.
Yeah, no, I
had
had after each service, I had after each service,
To the extent.
in FY 27 blank is appropriated. So the intent is that for each one of these buckets, that there's an appropriation tied to it.
And like
So-
a little, every time a hotel room is used,
That'll be in one bucket.
I see.
That'll be in this bucket right here.
Yeah, okay.
And it will also be in the shelter services bucket.
I see. Okay, yeah, that's
So-
explains what you're thinking.
Right, and the bucket that municipalities would apply for would be in this bucket.
Yeah,
And, you know, we can be as specific or not. I mean, we can reference all three levels, or if we end up with two levels, or
yeah, understand.
for some reason you think it should all be one. I mean, it's just trying to identify, it's trying to also get at this very first level is there's no eligibility. If you're out in the cold, you would have a place to be. It goes on what Ann was talking about before, like, you know, we're not checking your residency, we're not checking, you know, this is literally life-saving stuff, okay? Both number one and number two, when they are in that situation. That's why it says, you know, you don't have to be in coordinated entry, you don't have to do case management, but that's very time limited. Those shelters are episodic.
Yes,
You know, they're not, they're there for over a weekend or for 2 or 3 days, or maybe just sometimes 2 days or whatever. So, it's meant to be broadly available, but minimal
yeah,
requirements. Yeah,
understand.
go ahead, Lily, and then Ray.
Just to follow up on the discussion we started to have earlier, I'm not sure that after reading this and the section above, I would still interpret it as it's the 10 degrees Fahrenheit, and that if programs cannot operate at that threshold, that would not be a program. So I
On
just,
number one,
no, on number 2.
okay, I don't think we hadn't gotten through number one yet, I don't think, but are we through number one, or anybody have any other questions about number one?
I just-
We will come back to these.
I just have a
but-
question
Yeah.
to Doug's point. Just wondering if the way it's worded right now, would it prohibit the department to give like the money to one, or like could VIA get all the money and then grant it out to either municipalities or, you know, where the need is, right? Like, could that be kind of combined to gain efficiencies? Do we have to kind of spell that out, or would, you know what I mean? Because couldn't like one organization partner with the municipalities and give them the funding? So now the funding doesn't go from the state to the municipalities or VIA or whoever that.
But they have different
organization is.
cold levels associated with them.
They do, but.
So
Yeah,
they have to
but the
divvy
pot
them
of
up.
money could be with one
The pot of money
organization
could then
to
say,
then.
okay, you get, yeah.
I think that
So-
would be cleaner than the state granting out money to the municipalities.
So I really envision this number one as being more like in, not huge dollar amounts, but sort of like mini block grants to municipalities. So that's why I talk about minimal data reporting requirements, like, yeah, like how many days did you open a shelter? Like, I think that a dollar amount can be set aside at the beginning of the fiscal year. And then, we can, so the method on how it gets to the municipalities.
Yeah.
I guess the thing is that I also don't want to place an undue burden on a third entity to then manage a request process from 252 municipalities also, I guess. But maybe, I don't know, what do you think about that,
For the
Lily?
state to issue that many grants too, that would be a huge burden.
Well, I would, yeah, I don't know, what do you think, Lily?
I think to answer Representative Fairclough's original question, I do feel like the language currently in 1 and 2 allows some flexibility in terms of how to do that. And so I think it allows us to maybe explore some of those options and find the efficient way to do it. I feel like it.
Yeah, I don't think it prescribes that it has to be done
No,
in a
yeah,
certain
I think
way,
it's fine,
I
right.
think that-
just that they would be eligible for
Right.
funding.
Yes, thank you. Yeah.
Now that everyone's seeming settled on this, I hate to bring anything else up, but earlier you didn't want the language throughout the state, you wanted in each region of the state. Do you
Yeah.
want that on line 19?
Line-
19, page 9, 19.
Page 9.
Page 9, line 20.
Oh, I see.
Well, I
Well, it
think
says
it's different
equitable
because
access in the next line.
Yeah, I mean, I think we don't want the Northeast Kingdom to be forgotten, or Grand Isle, or, you know, Orange County, just because the numbers might not be huge in some of those places, but they still might have, you know, a need that they associate with. I think throughout the state is okay here.
Mhm.
Okay.
Okay.
because you don't,
For
you want,
equitable
Yeah,
access.
that's the
yeah,
key.
as
Yeah.
long as you say,
Makes sense.
yeah,
Yeah.
because.
Okay, now we're on number 2, Lily.
I think again, yeah, just circling back to my question earlier about this combined with the earlier definition, I'm assuming that then activation happens at 10 degrees Fahrenheit.
Yes.
And just sharing that observation that if we were to put out a notice of funding at 10 degrees Fahrenheit, I don't know that all of our current projects would participate. So
I think what we're trying to do is to be responsive to the feedback that we've gotten, that the current levels are too stringent, too cold. I guess it comes back into how OEO administers it. Like, you don't have to require it. It's just eligible for funding.
Well, the definition does suggest it would be required. I'm just looking back at the
Yeah.
definition because they are beds made available during those periods.
Yeah.
To publicly, so the definition, as opposed to the language later, kind of does lock it into that.
Mhm.
Unless it changed to, made available.
So
Well, it says it is at or below, so whatever, it could be,
Right, it doesn't,
yeah.
it says at or below. I understand what you're saying. I'm not sure how to specifically address it. I just don't, I'm not gonna put in policy something that says we're only gonna open a shelter at -10.
Son.
we can have our.
Yeah.
Yeah, go ahead, Zon.
So this is just because I probably don't know enough about what's going on in the state, but are there, I'm imagining that there are communities that have community partners, communities with community partners that provide shelter in those towns. And then it sounds as if there are communities that don't maybe have community shelters or community partners, but the municipalities take that on. So aren't we sort of making 1 and 2, as Doug says, the same thing? Well, give me an instance in which a municipality would open a shelter that a community partner would not.
In Middlebury, for instance,
So
there wasn't,
Montpelier, isn't Montpelier?
and
Montpelier,
not the city, but in Barry
Yeah.
City opened.
Right.
Barry City opened a shelter, but that wasn't that wasn't through Vermont Interfaith Action, for instance.
I'm thinking about so where I'm thinking about, you might be able to imagine is the communities where the hotel motel program was in those communities, and the communities feel the stress, the municipality feels the stress of it, the very thing you're saying, we're not going to, which I understand, we're not going to address that here. But it sounds as if we are in some communities, in fact, going to be addressing those kinds of issues. If the municipality opens the shelter as opposed to a community partner opening it, am I?
What we're saying is that it's open to municipalities to apply for. We're not going to directly put in this bill that we're reimbursing people for, police coverage or whatever, but
Yeah, I understand.
I think I heard Eric speaking about in Rutland, they use the library for overnight shelter for people, and people from first responders there actually got things set up and, did that sort of thing. That's why it says minimal record keeping requirements. I really do envision this as going out as a grant to municipalities within X, defined amount of dollars, and not anything that, you're not going to be building any new shelter. You're going to be utilizing existing resource, and, it could help you to pay for materials, or it could help you to, have the, local, you might make a contribution to the local food shelf, and in return, they'll fix meals or something. I don't think we have a defined way it can be used. That's the whole point. Is
Flexible funding.
Flexible funding.
it is.
Kind of an emergent need.
I think it's to recognize the fact that we have
They're
some
already
municipalities that have stepped up to do it, and it's meant to provide some financial assistance and honestly to kind of incentivize other communities to kind of step forward and provide that sort of fail-safe, particularly where we don't have formalized shelters, or where there's not an agreement with Interfaith Action or whoever might do it next year. They were only required to open up in 5 locations. Is that 5, Interfaith Action?
We did 6.
6. So we have lots of other places around the state. And then 8.
So, yeah, I'm still just really lost conceptually or philosophically, and I know we don't want to go into 3 yet, but it all relates. Why it would be 10 below 0 for a municipality to get a grant to open something, but 10 degrees for an emergency cold, which, and then, it could be 50 degrees and you get to use a hotel or motel because there isn't a 10 below or a 10-degree one open.
That's why there's different levels. Exactly what that means. So it's not generally going to be the same people who are going to be accessing all 3 of these, when we're thinking
Yeah.
about people who are going to avail themselves of these. So it is intended to be the first one being the first and this one both being the, do the best that we can to capture anybody who needs to have shelter, who has to have a roof over their heads, who isn't already, because there's going to be limitations on this, and there'll be limitations on, shelter services. So it is intended to be different. It is intended to be different.
Okay, what's the limitation on the hotels and?
I don't know. We haven't gotten there yet. It's going to be
okay.
It's going to be by appropriation. I'm going to throw out that concept of limiting it by appropriation as opposed to days. But that was a
I
concept
guess
that
I'd
got
rather,
thrown out.
it
Doesn't compute for you.
doesn't compute for me.
All right, well, let's
No,
process it a little bit more.
I want to, I would want, for people to have more access to shelter when it's colder rather than more access when it's warmer.
Yeah, I get you.
And this is reversed.
Yeah, maybe. I will say that part of my reaction to that and part of why there's actually, especially on number 2, is so that the department doesn't unilaterally impose something that was not our intent. But there's other words that we can use to do that without necessarily saying degrees. You know, we can say that there isn't any, you know, that communities can make their own decisions. I mean, that's part of what we're trying to think about here, is how communities make their own decisions.
If it's a quasi concept of a block grant, one would think all the more that it would be the community that would decide at what point they
At
would
what
try to
point.
do what.
But then you would say you'd have to open at, I mean, the way it's structured now is you get flexibility as 0, but you have to open at -10.
Right.
And so I guess I wouldn't want them to use up all their resources housing people at 30 degrees, which I don't think they will because they're not going to have
Well, we
the
use state
space.
resources to shelter at 50 degrees in a hotel room.
We are.
That's what doesn't make sense to me.
Okay, you'll have to think about that a little bit. We had Aiden and then you're good? Okay. Are you good or do you have something maybe?
Can I clarify that example you brought up of like the Rutland Library? So when you're thinking about the municipal grants, what in that scenario would be covered? Like that entire process of like law enforcement setting up like that?
I'm not going to govern what's going to be covered. I mean, I think the point is that it's flexible. They can decide how to use it.
I think, as I'm saying, I think my concern is maybe a lack of like clear legislative intent in that wording. And if it then goes to Department of Health to kind of dictate where.
DCF, yeah.
That one is like eligible for.
Uh-huh. I understand because our experience is that they're more restrictive than less. Yeah.
I just wanted to offer maybe, that, these past few weekends, which we have been working, there were municipalities that stepped up that maybe wouldn't have in the, so that is, to me, makes sense, the 2 separate pots for that reason. And just urging, that it not get lower than 10 degrees. And then also just the other thing that I would say, we haven't looked at the winter, what you're presenting for winter hotels, but that long-term housing is critically important and more stable. So this is like overflow is how I'm thinking of it. Is that how this is like people that don't fit in these categories or there aren't enough spaces for them?
Well,
Is
and
that how you're?
honestly, maybe I was thinking about the order of these being sort of least requirements on the household to more requirements on the household. You go down to number 3, you're going to be required to participate in coordinated entry. You're going to have a lead case manager assigned. You're going to be work on a housing plan. And that's not required for 1 or 2. So I was thinking about the sort of like requirements placed on the individual. And so that's why they're ordered in that way.
Mhm.
But I can see your point as well, Anne, in terms of maybe they should be reversed. I don't know.
The only other thing is what if there was language that, I don't know, and I can't read it right now, but the language that is that ensures that there is maximum flexibility, that those restrictions can't happen. I share this concern that could happen. So that is my other suggestion. And again, I can't read it, so I don't know if it's already there.
Well, it says minimal data reporting requirements and I am adding maximum flexibility.
And also,
You kind of have to sometimes think about, like, if you're a government employee and you're trying to do the best you can to implement legislative intent, but also be good stewards of taxpayers' dollars and all of that kind of stuff. So remember, this is all general fund, so it's all direct Vermont taxpayer dollars. So I get that. I just think like I couldn't in good conscience put a policy and statute that said -10. Yeah.
as I look at the National Weather Service declaration of a cold weather advisory in Burlington, it's issued when there's an 80% confidence of the event occurring And for cold weather advisory, it says apparent temperature of -20 and -29. Fair.
Wind chill. It includes wind chill.
Right, I assume that's what they mean by apparent temperature. But
I never heard it phrased quite.
I haven't either, but I'm looking at the National Weather Service. So cold weather advisory, apparent temperature of -20 to -29. And that seems
Wind chill.
But that,
colder than our intention.
Potentially.
Your uniformity with the other reference.
Because it says,
Yeah, I mean, is there, maybe having the same trigger?
Yeah.
Uh-huh.
I think we may unintentionally be making it colder.
My only intent was, there not being a decision that the department has to make. That was my only intent about that.
well, okay, well.
But I hear your feedback
Yeah.
that it may not it doesn't make sense to have two different temperatures.
It also doesn't say, does it differ based on where you're located? Or, I mean, there's a big variation between even, Burlington or way up in the Northeast or Bennington in the
Brattleboro, yeah.
Northeast, and the Northeast Kingdom. So when it's a cold weather advisory for what part of the state?
Well, I think we should think about eliminating cold weather advisory.
Mhm.
And think about having the same criteria, whatever it is, for number 1 and 2. Or we could also reframe it, and we could also reframe it that could be available for that numbers 1 and 2 could be available during those periods of time that we have, that we could use the same time periods.
And yeah, we just have to
Yeah,
dwell on it for a while.
For a while.
On all those different pieces.
yeah. What do people think about that idea? So instead of having temperatures per se, have a period of time, like December 1 to March 31st, that those would be available. Yeah, go ahead.
So currently seasonal shelters are allowable as shelters under the Housing Opportunity Grant Program, and they operate per those standards. I think
And what those standards, what does that
like
mean?
the Housing Opportunity Grant standards, and that's how they can apply for funding through that process.
And
I think
What is that? By the
Which has
temperature or
more-
by the dates?
by dates.
By date.
by dates,
Seasonal
okay.
operation. And I think I think emergency cold weather shelters are intended to be like a layer, right, that exists with these other types of interventions. And I think, again, allowing seasonal shelters to be an opportunity for funding through shelter, because there's just an operational difference when you have someone coming in like one night at a time. It really is that life-saving moment versus when you have someone there for months at a time and you have to start thinking about just like policies differently, storage of belongings differently. Are you saving beds for people differently? So it just, and I think then also that's some of the associated monitoring and data reporting becomes a little more robust. So I think that is a way to go if you wanted to just do seasonal shelters. I think that I would have concerns then about having it be too flexible because, and potentially setting projects up to have operational issues that they don't have a policy framework to work under. I also think, again, that's like a different approach, and I appreciate the sentiment, and like, if you move to seasonal, some of these spaces that we're currently using are like no longer going to be an option, right? So I think having it, those are just things to consider.
Yeah, I mean, if we define by seasonal, I haven't thought this through at all, but I'm just wondering, like the municipality could apply and say, well, we want to do, we want to do this as much as we can. We don't know if we can open it every night, but we like the grant for flexibility so that we try to meet this need, but we may only be able to do it when it's below zero in our town.
I think there are pros and cons, right, of how flexible, and then you potentially get a scenario where it's just incredibly hard for people to navigate what is or is not available on a predictable or reliable basis. And then that becomes, I think, administratively significantly more burdensome if you're allowing each town or community to operate however they want within a broad spectrum. So you could see like increased cost or pressures there as opposed to like direct services to folks.
Yeah, I mean, you know, I'm gonna be clear, I'm not expecting like a huge amount of money in this bucket number one.
Well, I think that's also then to have it very broad and then not necessarily the funding attached to it, then also could create some
It's not saying expectations.
expectation.
It's not saying expectations, that's the whole thing, it's voluntary.
And if it has just a relatively small bucket,
Right, I can see the city of Burlington applying for $500,000, for instance. That's not gonna happen. I mean, they might apply for that, but they're not gonna get it.
Yeah, those kind of resources are not gonna be available.
So we need to cogitate, we need to cogitate on this, but where I'm sort of thinking that we go is thinking about, periodicity, is that the right word?
Periodicity.
Periodicity. With, and actually being consistent, but then maybe some additional, a little bit of additional guidance, but thinking, you know, I think you raise an interesting point, Anne, in terms of thinking about how these are layered and, you know, for me, when I was thinking about this, I really was thinking from the perspective of the individual and what would be required of them. And, you know, moving from sort of what I would call least restrictive to more restrictive and more expectations. So, but I see other people are using different lenses and that's valuable to understand. So let's cogitate on that a little bit. And if anybody has some, don't send it to Katie, send it to me, because we don't need 5 or 6, right, we don't need 5 or 6 people sending it to Katie. So if you have ideas about how that could be structured, that tries to represent municipalities, a more organized version, an organized version of like what we have with the extreme cold weather shelters with Vermont Interfaith Action this year. And we can ask them. I mean, I know they're gonna have you're gonna have some feedback sessions with them afterwards. And then let's just talk about, we haven't talked about number 3, so let's talk about number 3. And then I'm hearing you say we should specifically add the term seasonal shelter here someplace, because that's some
term of art.
It's a term that is different than shelter or specialized shelter.
Right.
And it's
Or
not,
it could, as we operate right now, it would fall under shelter services, and I don't know that it needs to be called out, but that's a choice that you could make.
under number 2 or separate.
Or if it would say under 22.
Number 3 is out.
Or
2206, just under shelter services.
All the seasonal stuff is really in
Very
2205.
different, yeah,
Yeah.
yeah.
So, right, so then that would be a change of how we operate now.
Yeah.
And I think that would then,
All this is coming out of the same pot of money as it does now, Lily.
yeah, I think in terms of then it would need to maybe be a 4th one, because I think you would also.
Maybe its own thing.
Right, you would have to have your own guidance and expectations and maybe a little bit more in terms of like policy and reporting.
All right. So can you give me some words about seasonal shelters?
Sure.
Okay, let's move to number 3.
For use of hotels and motels between December 1st and March 31st of each year, when no other temporary or permanent housing or shelter services are available. Services provided pursuant to this section shall not be on a night-by-night basis and shall require coordinated entry assessment and assignment of a lead case management entity.
So, let's talk a little bit about, keep putting this on, not looking up and down, I'm getting dizzy. Um, in testimony last week, we heard, well, what about, and I don't think people hadn't necessarily thought it through, but as I started to think about it, I sort of like the idea, about this being, limited by the resources that are appropriated to this line as opposed to a quote unquote number of days. What are people's thoughts about that idea?
Sorry, yeah, can you repeat that? I'm not sure I got it.
So instead of limiting by a number of days, so we would still say, we'd still need the language that the department in its budget presentation recommend a daily dollar amount to be paid to hotels. That the limit here would be by what is appropriated in this bucket, not necessarily number of days.
Right, so much money, is that what you're saying?
Yeah.
Can be spent on one person or one family or whatever.
Well, no, that can be spent in this area, period. Yeah, you know, in other words,
But what would your cap on money be?
it'd be through the appropriation process in the budget.
Oh, makes sense.
So the department recommended, for instance, that there not be a day limit for families. In their proposal, that's their proposal. I'm just throwing it out there because it was a concept that was just briefly mentioned last, and the part I like about it is it gets us out of this argument and
Yeah. But do I understand it correctly that it does potentially mean that at one moment, there would be no more hotels or motels available?
they have to, but they have to budget.
Budget, yeah.
I mean,
But it means that, I mean, already it's limited by the number of hotels. This would be
Right.
limited by the amount of money, but in terms of when you run out of space, you run out of money, that's no different.
The budget
Yes.
would have to be done with some sort of prioritization, I imagine. So, and they talked about potentially no limit on days from their perspective for a family. So again, I'll get back to the question that I posed last week was, I'm 59 years old, single, let's say. I don't have a family, I don't have kids, I don't have a substance use issue, medical issue, et cetera. I imagine that I will be on a lower prioritization than many other groups. So we have to be aware of whether that's our intention or desire, because I think if we're not prescriptive on what criteria we want, the department will create some.
Well, if it's purely a cap on money or rooms and nothing else, then it's sort of like first come, first served, which is not necessarily.
Maybe or maybe not.
Right.
Maybe it may not be.
No, I'm just saying, I mean, whatever we might want to say, I mean, it could be first come, first served, or it could be prioritized. But because it's coming, if it's coming through coordinated entry, doesn't that mean there's a priority process?
Yes.
That builds in a sort of case by case.
Right.
A cap on money could also allow them to negotiate on price like we talked about in the past. So they may be able to extend accessibility at less price.
Well, and remember, this is not the only place where hotel and motels are used. There's
Mhm.
hotels with supportive services on the
Right.
next page.
Exactly, yeah.
Yeah, go ahead.
Just a point to ask throughout the bill, where this really is department versus where this would be the Office of Economic Opportunity. And if this is intended to be use of hotels and motels either organized and facilitated by the state, or if this is intended to be grants for communities to access hotels and motels as part of a program.
Wow. I have a preference, but I didn't contemplate that here. Because the management of that at the local level was vetoed last year. So this is as written would be by the state. In OEO, not economic services.
So then I think that brings up administrative questions that we will have to get back to you on, because economic services leverages a system that supports the administration of other benefits. To create and replicate that, I think we're trying to get with no costs.
Well, we would intend for the state to utilize HMIS. In other words, this is not going to be a benefit necessarily because it's not a benefit anymore. So it's not going to something that automatically entitles you to X, Y, and Z. If that's what you're talking to about. It's a different mindset. It's a very different mindset.
But in terms of, I mean, so would referrals then come from coordinated entry lead agencies? The state to make the reservation, or coordinated entry lead agencies make the determination?
You know, my preference, I mean, I would be fine with this being at the local level. So why don't you get back to us about that?
That's helpful.
Can we define the understanding of local level? I thought I had heard, Lily, you say something, it seemed like it was more community/municipality based. That's not what we're talking
No,
about.
no.
Community partners, as we did last year. Yeah.
But the way it's written, does it prohibit the state to enter into an agreement with the community partner to administer the eligibility and
No, but we could-
provision
It's not
of-
specific at all.
But we
here,
could
right?
say that.
Right.
We could say that, like we do in some of the other ones that the state enter into it.
Right, because I mean, I imagine the community partners already have kind of relationship, right? They already have a lot of this infrastructure built, so if we just say the state can enter into agreements with those community partners to ensure this happens.
So Katie, just for placeholder right now, we use language back here someplace that says the state will enter into agreement with one or more community partners to administer.
Mhm.
Let's just.
Number 2, it says it. Actually, right
Okay,
above.
right there, yeah, number 2. So why don't we just put that in here as a placeholder for right now? Recognizing that this requires some thinking. Okay, so, I think this is a good place to stop. Because then we're gonna get into shelter services and specialized shelter.
Lots of questions.
Lots of questions, right? So, and then I need a definition for permanent supportive housing or help with doing that section. Anybody has any great ideas about that?
Page 13.
Yeah, Jubilee, I don't know if you have any, I mean, we can take language off from the internet, but, I wanted it to be something that had some reference to what we actually do in Vermont. So if anybody has any suggestions, did I ask Lily for that already? No, I asked you for something else. I forgot what it was. Oh, yeah, seasonal shelter.
Services. Rental systems or the services, both,
I'm sorry, what?
are you thinking the services like different services or often the rental system?
Well, this is kind of where I was thinking about the inserting the rental assistance
Okay.
piece. Scott, does anybody remember the crossover date? Is that the 18th?
Friday after town meeting.
50.
13th.
13th, Friday,
The 13th, perfect.
Great.
I thought there was gonna be a request for an extension.
Not
No.
for a crossover, but for our recommendations. to-
Budget recommendation.
Budget
To approve.
Yeah. I've already assumed, I'm not asking, I'm just assumed that. Right. Oh, I forgot we had an appropriation.
It's me.
We have a lot of work to do.
I absolutely, yes, you do. I'm so alive.
But we are gonna be fewer in our recommendations.
Yes.
I really tasked our group to be,
Very focused.
if they
And we have a
recommend.
Yeah.
If they recommend something.
Yep.
That's not on the governor's list, they gotta find a
Source of revenue.
source of revenue for it.
Oh, I didn't know that. That's good.
Yes, I've
So
said that.
it's not on the governor's proposal.
You have to find it, you have to find where either you're gonna cut something else or you're gonna find the money.
I didn't, okay, I didn't catch that part of it.
That's all right.
That's from your.
Yeah, I like hearing that from the chair.
So it's gonna be, it'll be fewer recommendations from our committee, because there's less money.
Yeah, based on the last couple of years that I.
Fine, it was the last couple have been exceptions, yeah, we were, our budget memo and our accompanying chart was like,
Yeah.
really long. Thank you, Lily, you're very fast. Okay, so, tomorrow, you have budget work first thing in the morning at 9 to 9:45, and then we are having a public hearing on, Recovery Day, and we're gonna be down with Senate Health and Welfare. We're having a joint meeting with Senate Health and Welfare. Which will be nice. We'll be hearing from people with lived experience as well as some providers. And then we are going to tackle what I thought would be an easier bill, and turns out it's not so easy, 660. Okay, that's the opioid abatement special fund. And then, for Disability Advocacy Day at 1:00, we're gonna be having another joint hearing, 2 in 1 day.
And clarification, they'll both be in room 10.
They'll both be in room 10, okay, not room
There's
11.
not a lot of people in this little room.
So if you want a seat around the table, you should get there early. And that's it, we're gonna hear about the, group that, Ann worked on, Act 69 over the summer, and we're gonna hear the recommendations from that group. Then we're coming back to mark up on this bill that we've been working on, okay? All right, yeah, questions? Anybody have any questions?
Right here.
I have to, but it's also Vermont 2 on Monday, legislature tomorrow.
That's right.
Julie's
that's
not here to be able to share that with you.
Okay,
Hopefully Someone may be able to step in her stead and offer the proclamation
oh, all right.
of the House floor.
If Jubilee's not here, do we have a volunteer to do that? Okay, thank you, Esme. Thank you for mentioning that, Bev.
You'll be in the park.
Okay, all right, and it's kind of, because we don't convene till 3:30, so I was wanting to make sure, for instance, that there was still gonna be people around at 3:30, so, and apparently there are, so. Okay, anybody have any questions? Also, at the end of the week, is that the end of this week, Lori, or beginning of next week? Hearing from committee, doing a debrief. And well, let me ask you all, because you all are meeting with departments and advocates and stuff. I need to have your recommendations for who you want the full committee to hear from. So that we can schedule them for next week. So,
By the end of this
I
week.
need, yeah, sort of by Friday morning. I need to have your recommendations. Everybody know what I'm talking about?
Yeah.
Okay, and don't say everybody who's talked to you. Okay. Okay, and just to remind people that, on 660, we're not hearing any additional verbal testimony unless it's from the department. If you need any clarification to the memo that they sent out, that Shayla Livingston sent out, we can ask her if she can be available by Zoom, if we need any clarification for that, okay? All right, and then, so next week we'll take testimony from the community partners who you have recommended. And just to be clear, they're only going to get 15-minute spots. Okay, 15 minutes. Because I will have a number of them, I'm sure that we will need to make sure that they're brief, and they should have their written comments prepared ahead of time and submitted to Lori. All right? That's right. Okay. And then, at the end of next week, at least maybe by Thursday, we're going to do a debrief. You're going to be making your recommendations about what you think your department or your part of the department, should get funded. Now, Esme and Jubilee, you have we're doing all the housing stuff in this bill, so don't worry about the housing stuff. Just worry about Reach Up and SNAP and the other stuff, okay?
Teresa, or Chairwood, we have a number of requests that are kind of like navigation related positions that are directly part of this whole homelessness conversation. And so I'm not sure if we should consider that as part of our conversation with this bill or consider them separately. And we can talk later if that's better.
Okay.
But just wanted to flag that.
Are you talking about something different than the assisters?
There's the assisters, there's, a request from a municipality. There's,
Even 211 is kind of housing
Yeah.
navigation related.
yeah. So there's a lot of requests that kind of touch on it. And I
Okay.
can send an email, like kind of listing out the various requests and how they intersect, if that would be
Okay.
helpful.
I'm familiar with the Barry one, and honestly, that would come under whatever we decide to put in the bucket for municipalities.
Okay.
If that's how they decide they want to use their, if they apply and they're granted funds, we're not gonna have special funding for Barry. Just, we would have municipality after municipality lining up.
Yeah.
Yeah. Yeah. So they can use the funding that, that's why I said it's flexible. And if that's the way they support their community best, they'd be able to use some of that if they wanted to, if they were funded under that. In terms of the assisters, that really crosses over, not just us, but also healthcare, because it has to do with Medicaid eligibility.
Sisters?
They're called sisters, yeah.
Sisters.
Sisters?
Assisting someone.
Assisting someone.
You-
Oh, it's like a nonprofit?
Yeah, you have it in your email. I sent it again out.
When you get 100 a day, you know what it's like.
Oh, God, trust me, I do, yeah.
I must have missed a sister.
It came from, I think I forwarded the one that came from Amy Schollenberg, I think is the last. one that I
Okay,
sent you.
I must
I
have.
mean, you'll get to see it from
I'm
me,
not
but
saying I didn't see it. It's just.
no, I think you also all got it from Amy as well.
Okay.
I just put it at the top of your inbox.
And the rental bridge program too will be relevant.
Yeah, we're gonna have that whole discussion when we talk about the rental assistance aspects and where we think it should be.
Cool.
I think that we know we need it, but where it's housed and how it's run,
Yep.
I think that'll be that discussion, yeah. Wrapped up in this bill. Okay,
So this would be the ESME, right? The assistance?
Yeah.
Because it says SNAP and,
yeah, oh, you got it right there.
oh, I had that.
Oh, yeah, I should have known that Amy would be gonna pull it right out of her magic trick bag. All right,
Just test.
Yeah.
I know.
My plate's very done.
Yeah. And I like paper.
Okay, anybody else have any additional questions or anything?
No.
Okay, well, thank you for your work today and thank you for thinking this through. All right, Lauren, we're done. And so just to remind people watching in, we won't be back until 9:45.